You are properly recognized.
Thank you, Mr. Chairman. The bill is in its proper form. A brief description of the bill, because I know you are busy today, and I do have a couple people that wish to testify on this bill. Members, House Bill 3 expands the offenses of assault and aggravated assault against a first responder or nurse to include offenses against any healthcare provider who is licensed, certified, or otherwise authorized or permitted by the laws of any state to administer health care in ordinary course of business or practice of a profession, Mr. Chairman.
Thank you. Are there any questions for our sponsor? Representative Johnson.
Yes. Thank you, Mr. Chairman. I was curious, are there other states that do this, sometimes with enhancements, making other groups, putting them ahead of others? I understand there are a lot of attacks on medical personnel. Are there any other states that do this, that demonstrate that enhancing these punishments are effective? I'm curious to know, not just do they do them, but have they been effective? Because a lot of times with enhancements, we don't see that there's an effectiveness after that.
To answer the question directly, is I know there are other states considering this legislation this year. I'm not aware of this bill having being passed with the enhancements. There are enhancements in first responders that are already there to protect them. One of the things that we're seeing right now in our healthcare workers profession, that assaults, if you work in a healthcare profession, you are more likely by 20% to be assaulted in your job. Down in Murray County at Murray Regional, we now employ 18 security officers and 4 guard dogs to deal with these assaults that are happening on our healthcare workers. It's not easy to realize that a dog showing up to an issue tends to calm people down very quickly. But this is getting to the point where our healthcare workers are starting to decide whether or not it's worth being into business right now when you can have people that you're trying to help assault you. And so we're trying to extend the coverage to provide a level of, I guess, a level of respect for our healthcare workers, and trying to set a tone in Tennessee that do not assault the people that are trying to help you.
Is there any research to indicate like how many of those folks might have mental health issues, dementia? You know, a lot of, you see more in the health field because of some of the folks that they're dealing with. And so I'm just wondering what the research says and research of success based on enhancements. Well,
the enhancements are going to allow the opportunity for those individuals who may not have, who are not getting the treatment they have. With the enhancement there's a mandatory minimum of incarceration. That would give the locals the ability to start the process of intervention on either mental health, behavioral health, drug addiction, alcoholism, things that may be the underlying cause of this. It might be a way for those to get them channeled into a program that might help them out. One of the major incidences we're seeing right now against health providers is drug-related and behavioral health-related, people in search of the meds that they were getting before. The problem is the healthcare providers are starting to say, no, we need to go a different way, and people don't want to hear that answer, and that's when the fights break
out. I hope that is what will happen. I have some concerns when you say that, you know, what we would like to see happen. Mm-hmm. Unfortunately, corrections doesn't always agree with the things that folks want to see, but thank you.
Mr. Chairman, one of the bills we passed, I don't know if it was a year ago or 2 years ago, we provided more money for our local sheriffs to get into these interdiction processes, and my sheriff down in Murray County has seen a tremendous result from this, of people getting into these programs, getting the help they need, and getting their lives turned around. So anything we can do to get people pushed in the right direction to make sure that they're able to take care of themselves, not only benefits them, but it benefits all of us in Tennessee.
Thank you for that. 2 things. One, I forgot to mention earlier. We've got a hard stop at 1:30 in here today. 2, we do have witnesses here to testify. I've got Chairman Hulsey on the list. You can wait. You can wait. All right. Without objection, we're going to go out of session. We're out of session. We're going to hear from James Howley. If you would come up here to the microphone and introduce yourself. You'll have 3 minutes for testimony, and then at which point we'll be keeping the clock up here, and we'll let you know, and then we'll have Mr. Chandler Anderson follow you up. You'll introduce yourself. You'll have 3 minutes for testimony. Then we'll have questions from the committee. So, Mr. Howley.
My name is James Hawley. I've been a nurse for 25 years, and before that, I was a paramedic in the boroughs of Brooklyn and Queens. During my career, I've been punched, kicked, spit on, coughed on, stabbed, and verbally threatened. But I love the work. I was asked to talk about an incident that happened about 12 years ago at a local hospital here in Nashville, where we had a gentleman come in, and he had suicidal ideations. And while he was being medically cleared for other help, he decided he wanted to leave, and that was not going to happen. I went in as the charge nurse, and I sat down and I spoke to him in a calm voice, saying that we were very concerned about the threats that he made on his own life, and that we were going to keep him safe until an evaluation could have been accomplished. He pulled the IV out of his arm. When I went to bandage his arm, he lunged at me. The security guard laid on top of him. He got the gun out of the security guard's holster, put it in my stomach, and attempted to pull the trigger while verbally saying, "I'm going to kill everybody in this room." And there were 6 of us in the room, including 2 certified techs, a doctor. So there were people in that room that weren't necessarily covered by the bill that's on the books right now. The gentleman was arrested, and he got 60 days probation and was released early for good behavior. We had another gentleman come into the ER, and our registration clerk asked for an ID, just a name and a date of birth, and he pulled a pair of scissors and tried to stab her in the neck because he was tired of waiting. So my testimony here is to say that there are many people on our team that work inside the hospitals that aren't necessarily a nurse or a licensed professional that aren't covered by the current bill. The other thing I wanted to say was that if these same people with these aggressive acts were to do it on a street corner, you know, they would be arrested on the spot, regardless if they were drunk. And I think Ms. Johnson had a good question about mental illness and about alcohol and drugs in the system. But these same people would be arrested on the spot, and they would be processed, you know, and all those things would have been taken into consideration. It just seems when you enter a hospital, you get a free pass, you know, and there are many people putting their health and well-being at risk. Our screeners now, you know, with the pandemic, with the recent pandemic that we had, just asking people to come in that want to be seen to put a mask on. They're verbally assaulted, they are coughed on, things were thrown at them, you know, and these people here need protection, you know.
I'm sorry, Mr. James, your time is up. Yes, sir.
Thank you, Mr. Doggett.
Yes, sir. Thank you. We'll hear from Mr. Chandler Anderson. If you will introduce yourself for the record, and you'll have 3 minutes for comments.
My name is Chandler Anderson. I'm advanced practice. Can you hear me now? Oh. Chandler Anderson. I'm a nurse practitioner down in Columbia, Tennessee. To your point, Ms. Johnson, I see psych patients every day at a local inpatient psych hospital. This wouldn't be something that we would be doing for those people because we identify they have an acute mental illness that we know when we go to work every day this is possible. But to quickly, as I can, tell you the story, last year I had a call that I never thought I'd get from one of my nurse practitioners who said, "I've been punched in the face by a patient." And I said, "I'll be right there." So went to the office. I own a chain of clinics there in Columbia. And on the way there, I'm thinking, man, somebody wanted drugs. She told them no. They punched her. That's a huge part of the opiate epidemic. If you talk to providers, it's the path of least resistance. It takes 5 minutes to write a Percocet prescription or send it electronically. It takes 30 to argue with somebody about why they don't need it. And then you're in a room alone where there's no camera, there's no witness. I think my friend Randy Tidwell, who's a NP in Portland, was beat down into the floor. His face was broken, and the police had to come. The guy was arrested. I get to my clinic, back to the story, and I go in, I ask the NP, what happened? And her nose is bleeding. I had to sew her nose up. She said, I honestly don't know, because all she was upset about is I didn't have a CT scan someone else ordered. And I told her, give me 24 hours and I'll get it, and then we'll get you referred. But any of you that have ever had to have a medical referral to a specialist, they want every recent scan you've ever had. And ironically, this NP's husband worked for the person we were going to refer him to, so she knew that this would expedite things. And the girl turned around and punched her in the face. Now, thankfully, due to General Cooper down in the 22nd Judicial District and Bucky Rowland, our sheriff, she's spending 30 days in jail. The good thing, though, Ms. Johnson, and the good thing about Bucky Rowland is he has Michael Fulbright there who helps make sure these people get the mental health assessment. That girl has some mental health problems. She wasn't having an acute thing that day, but she has some anger issues to punch somebody in the face because you didn't immediately get what you wanted. And that's where our society regretfully has gone to. PAs, physician assistants, aren't covered under the current legislation. Physicians aren't. Certified nursing assistants aren't. Respiratory therapists aren't. Radiology people aren't. Physical therapists, occupational therapists. That's why it's important to expand that. We don't want to create special groups of people, but we're the only people that work intimately behind closed doors without a witness. You can't put cameras in exam rooms where we may be attacked. Randy's nurse found him down the floor after he tried to fight back. We're all getting older and can't do that anymore. So,
Thank you, Mr. Anderson, for your testimony. Our time's up. Members, do we have any questions or comments for our guest? Chairman Russell.
Thank you, Mr. Chairman. If somebody's charged with assault, what are you allowed to tell the court that does not violate HIPAA?
Once it's a legal matter, HIPAA no longer provides any protection because then it's a flow of events. And so HIPAA, the Office of Civil Rights, we actually contacted them when this occurred. HIPAA kind of goes out the window with that because it's now a legal issue. I mean, the attorneys may speak to that too, but it kind of goes out the window.
Thank you.
You're welcome.
Any other questions? Seeing none, thank you both for your time. Thank you for being here with us today and for your testimony. Without objection, we're going to go back into session. Chairman Hulsey, you're recognized.
Thank you, Mr. Chairman. To the sponsor, to follow up on the representative from Knoxville, you and I have talked, and I have problems with passing legislation that makes the administration of justice unequal and tips the scale and takes the blindfold off the lady. You and I also talked about the possibility, if this comes out of this committee between now and the full committee, there might be a solution to level the playing field for everybody. Is that still a possibility?
Mr. Chairman. Yes, it is, Chairman Elsie.
Okay, thank you.
Representative Russell.
Thank you, Mr. Chairman. Just to clarify, this does not reclassify healthcare professionals as first responders.
That is correct. Yes, sir.
Thank you.
Any other questions or comments for our sponsor? Seeing none, we're now voting to send House Bill 3 on to full criminal. All those in favor say aye. Aye. Those opposed? The ayes prevail. You move on to full criminal.
Thank you, committee.
Item number 2, House